My Lord, I'd like to start by thanking the Noble Baroness, Baroness Thornton, for bringing about this important debate. She's held the government's feet to the fire. In fact, she held my feet to the fire on this issue, and I absolutely commend her persistence. My Lords, rehabilitation in general and post-viral syndromes in particular have a long history in this country of being horribly overlooked, and that regretful neglect has contributed, I'm afraid, darkly to the long-term poor health of many in this nation. But before I speak of the consequences of this over long COVID, can I just take a moment to recognise that Britain has done more than almost any other country to address long COVID. Professor Chris Whitty in the CMO's office prioritised NIHR research with £50 million going into 19 projects, giving a clear signal for other research. The NHS, and in particular the Noble Lord Stevens of Birmingham, launched a welcome 5-point plan that the Noble Baroness mentioned. And Amanda Pritchard has rolled out excellent long-term long COVID clinics. Treatments like monoclonal antibodies and pulmonary rehabilitation are emerging as a result. And can I pay tribute to Dr. Harry Brunge, who pioneered the Breathe programme at the English National Opera, a fantastic example of social prescribing, which has produced some very promising clinical trial results. Can I thank the Noble Lord Darzai, who kicked off the important REACT programme at Imperial College, which has generated hefty longitudinal population studies. And lastly, can I pay tribute to the patient groups who are both vocal and thoughtful in their response for their testimony. But, my Lords, despite these considerable collective efforts, I am sad to say that the long COVID story has become a parable for how the UK health system fails to protect people's freedom from disease and illness. It fails to properly rehabilitate our sick, and we're paying a horrible economic price as a result. My Lords, the scale of long COVID is enormous, as the Noble Baroness rightly pointed out, but that clinical response that I referred to is sadly inadequate. The ONS says there are 1.5 million sufferers, yet the long COVID clinics can only see 60,000 patients a year. Patient groups are frustrated that when they do get seen, clinicians don't have the latest pathways that might lead to positive outcomes. NIHR agree with patients that there are a lot of unanswered questions. My Lords, we are familiar in this country with the rationing of scarce health resources and the uneven distribution of the latest research, uncomfortable though that is. But I would like to focus a few words on the profound economic effects of this troubling British healthcare strategy. The ONS data reports that 500,000 have left the workforce over the last 18 months, and 75,000 of those are economically inactive due to long COVID. The IFS, the Institute for Fiscal Studies, has a slightly different figure, 110,000, and it says that the cost is almost 1.5 billion in lost earnings a year. Another IFS study suggests that there is an average of 2.5 hours per worker of sick leave due to those who have long COVID. Either way, the OBR has recognised that the welfare cost of long COVID, of COVID in the round, is around £2.7 billion on welfare benefits like incapacity and housing. My Lords, that is an absolutely staggering sum. My Lords, my point is that we can't shrug our shoulders about the impact of conditions like long COVID on the economy. We have to take on the challenge of making this country more healthy and make a pivot towards prevention. Andrew Haldane, Chief Executive of the Royal Society of Arts, put it well in his recent speech. We're in a situation for the first time, probably since the Industrial Revolution, where health and well-being are in retreat, he said. Having been an accelerator of well-being for the last 200 years, he added, health is now serving as a brake in the rise of growth and well-being for our citizens. And yesterday, Andrew Bailey, the Governor of the Bank of England, told the House of Commons Treasury Committee that part of the reason why the country was being held back was the sharp decline in the size of the workforce since COVID. And yet, despite this, my Lords, the Treasury plan for living with COVID makes no mention of investment in rehabilitation or major initiatives for getting the workforce back to work. Finances in the UK Health Security Agency and the Office for Health Inequalities and Disparities, the main legacy public health organisations.
Does the Noble Lord agree there is a growing concern about the effects of booster vaccinations and the serious side effects they can have, and I wonder if he agrees with me that the government should be looking at this very carefully.
My Lords, the vaccine programme has been an astonishing success, and the uptake of those vaccines has shown that there is enormous public confidence in our vaccines, and I would speak at another date about what a profound impact that has had on the health of the nation. But my Lord, my points here are that just at the moment when we are feeling very heavily the effects of COVID on our workforce and our economy, the finances at UK HSA and at OHID are under huge pressure. The public health infrastructure built over the pandemic has largely been dismantled. And at the same time, we have an NHS straining to look after the sick, and we have a workforce, many of whom are too sick to work. My Lords, by way of conclusion, can I say it is time that we work towards a new political settlement that prioritises the health of the nation and not just the treatment of the sick, and that we make the operational decision in health and care to move towards